welcome to our nitty gritty talk. So on week 3, we usually have a discussion where it is just the woman here with Natasha and I, and we take this opportunity with just the woman here to talk about some of the extra details around having a baby and labour and birth, and bits and pieces that we haven't talked already about, and just different bits and pieces too that as a midwife and as a woman that's had a baby, just little bits and pieces that you really want to know about so that you know that they're normal when they're happening. So we have come up with a bit of a list of things, and Natasha and I are just going to run through them together and just give you a bit of a heads up about some of the things that can happen with your body around having a baby. So our top thing to talk about is whether or not you can pass a little bit of poo while you are pushing out a baby. So women often hear about this. They hear that you might poo when you're pushing out a baby. They're never sure whether it's true or not, and like how much poo, if you're going to poo, that kind of thing. But often women aren't game enough either to ask the question about whether this happens. So we always bring this up in classes and cover it for women. So absolutely you can end up pushing out a little bit of poo when you are pushing out your baby. It is only ever a tiny bit, it's never a great big amount. It is always a little bit of hard poo. It's easy to clean up, easy to get out of the room. People worry about what if it's like diarrhea and it makes a big mess. It won't be diarrhea, it won't make a big mess. Midwives at every single birth that we're at, we have this special delivery pack that we open up when we know that a baby is on its way, and as part of that pack there are wipes in there. Midwives have got gloves on their hands, and that when you are, whatever position you end up in pushing your baby out, if we can see that you're going to poo, we use the wipes and we put it over your bum hole and we catch the bit of poo as it's coming out. And even if you have got people down there watching this baby come out, they often miss the fact that you have passed a little tiny bit of poo because we've got it covered up with the wipe and with our hand. We catch that bit of poo, we've got a bucket that we use in the room, we pop it into the bucket and then we get that bucket usually out of the room fairly quickly, so nobody sees it, nobody smells it, and a midwife absolutely does not care if you pass a little bit of poo. She is not going to stand there and say, oi, oi, go to the toilet or go and sort yourself out. She will sort it out for you, and we do not care. We don't care about the smell, we don't care about how it looks. So we sort that out. I like it, Natasha calls us poo ninjas, and we are totally poo ninjas. You won't know, and nobody that's in the room will know most of the time. So sometimes people poo, but sometimes they don't. Sometimes in early labour, when you start to feel those crampy pains in your tummy or in your back, sometimes people get where they end up with a bit of runny diarrhea on the toilet, and it's like your body's just emptying that. And if you end up doing that in early labour, really unlikely that you'll push any poo out when you're pushing a baby out. But when that baby's head is coming down through your pelvis, so if I use the pelvis here, and your baby's head is coming down through there, your bowel runs right around the back here by the pelvis. And so if your baby's head is coming down through, and if you've got a bit of poo sitting in your bowel, sometimes the baby's head as it's coming pushes that bit of poo out in front of it. But we absolutely sort it out. You don't need to worry about it. Sometimes people do pass a little bit of poo when they're in the water too. So you might be having a water birth, and so if you see the midwife, we have sieves that we have in our delivery rooms where the birthing pools are. If you see her trying to catch something in the water, it might just be a little bit of poo that she's just collecting out of the water. And it is not a big mess. It doesn't matter. We don't care. So hopefully that's cleared up the poo talk for you all. And so another thing that can happen around that area of your body, and this can happen in your pregnancy and it can happen after the baby as well, is something called hemorrhoids. And so that's quite a common discomfort of pregnancy, and so it's related around all the hormones that you get when you're pregnant. Sometimes you can have around your bum hole, and you'll notice it when you do poos or when you wipe after doing poos, that it can feel a bit tender, a bit sore, a bit painful around your bum hole, and that when you're wiping it can feel quite bumpy and quite swollen, and that might be hemorrhoids, and that's little tiny veins that usually sit inside your body, and they actually with pregnancy just sort of start to come through your bum hole a little bit, and we call those hemorrhoids, or piles is another word for them. So it can happen in your pregnancy, but with the process of pushing a baby out, sometimes you can get hemorrhoids during your delivery. If your midwife sees that after you've pushed the baby out and she's checking all your bits afterwards, she'll mention that to you and give you some cream if you need it. The cream works amazing. You just pop it on yourself and the hemorrhoids shrink and go back up inside your body where they're meant to be. So if it is something that you're struggling with while you're pregnant and it's getting uncomfortable, talk to your midwife. She can absolutely try and figure out how to make those feel more comfortable for you. But like I say, really common after you have a baby as well.
If you find that you've got hemorrhoids and they're a bit uncomfortable, roll a towel like this and put a butt cheek either side, and that just lifts you up off of the chair a little bit. So then it's a bit more comfortable. This is also good if you've had stitches or you're just feeling a bit swollen down there, to give you a little bit of lift off of the chair. And that's a really good tip to do that one. Now, while we're on the bowel department, women find that they don't do a poo again for 5 to 7 days after they've had a baby, which might be a bit of a shock if you're an everyday kind of person. It is quite normal. Your midwife will be checking in with you and she'll ask, have you been for a poo yet? And you're like, weirdo. But she's just checking to make sure that everything is functioning as it should be again. And your body's had this big shock. It's birthed your baby, it's trying to heal, it's trying to make food for baby. All your organs have suddenly got all this more room. So the last thing it's thinking of doing is processing all the food that you're putting in. So just give it a chance to get back to normal. And you know, if it's getting uncomfortable, tell your midwife, get some mild laxatives to help. And it's really good as well to drink lots of water and have lots of fruit and veg, and things like kiwi fruit is really good for making sure you don't get constipated. And when you do need to go, don't hold on because you're nervous. You know, you don't feel like pushing, or you're scared you're going to burst stitches or something. Honestly, just go and you will feel so much better. If you hold on, it's actually going to make the situation a lot worse. So go, you'll feel better, your midwife will be like, woo, yay, everything's working good. So definitely you're going to be so thirsty anyway, so drink lots of water, and the fruit and veg is really important. So if you are nervous about pushing because it feels like everything's going to fall out, grab a maternity pad or a wad of tissue, wrap it around your hand, and you can hold that against your perineum so you feel like you've got something supporting you when you're pushing. That's a good tip as well. So the rolled towel and the pad or the tissue paper around your hand to give a bit of support when you're pushing.
So it can be tricky to do poos again after having a baby, but also it can be a bit tender and a bit stingy when you start to do wheeze after having a baby. So when you've initially pushed your baby out, you are sitting on the bed, you're doing the breastfeeding, your midwife's checking your perineum and helping you get the placenta away and that kind of thing. And you end up sitting on the bed for a while, and then you get off the bed and you head to the shower for the best shower in the whole world. It feels amazing after having a baby. When you get up off the bed, don't look back at the bed. Just walk away, and when you come back, your bed will be nice and fresh and clean, ready for you again. So we have toilets and showers in each of the delivery rooms. So you head off to the shower, and then in the shower, we really like you to try and go wheeze while you're standing up in the shower. And that just tells us that your bladder's working okay, and that you can pass urine. If you have any stitches or you have any grazes or tears down there, it can be quite stingy when you pass urine. So something that you can do in the showers at the hospital, all the shower heads come off. So just have it going gently and just squirt it down around your vagina as you are doing wheeze in the water. It helps to just dilute the urine, and it doesn't sting as much. So you can do that when you do your first wee. This is only if you've got some tears or grazes, otherwise you might be just fine. But you can get a sachet in the hospital called Uril, and your midwife might offer you that. So it's something that you drink, a sachet that you put into water, you drink that. It has an unusual taste, but it neutralises the acid in your wheeze. So if you are struggling to urinate, you can have that little drink and it makes it easier. Another thing about doing wheeze is that after you have the baby, you can actually hold on for ages. And it might be hours before you need to go to the toilet again. And when you actually hop up to go to the toilet, this is just in the first day or two after the baby's born, as you're walking to the toilet, your bladder might actually start letting go of your wheeze. And you see women doing that where they're walking to the toilet normally and all of a sudden they stop and you can see them going, oh, and that's they realise that they're passing urine, and then they do this mad waddle to the toilet. Okay, doesn't mean that your bladder is completely stuffed. It just is your pelvic floor and your body getting used to it. It'll just do that for a few days and then you will come right again. But a really good thing to remind you to keep doing those pelvic floor exercises. Do those tight squeezes down there to get all that tone back in those muscles. The great thing about this time is that you have a humongous pad between your legs, so you don't make a big mess as you're going to the toilet. So it can be a bit stingy and it can be tricky to hold on to wheeze in those first few days.
I'm going to talk about blood loss at the birth. So like we said earlier, before baby's born we don't want any bleeding, but when baby's born that placenta is going to separate from the wall of the uterus, and that's when we expect a gush of blood, because there's lots of little blood vessels being joined together, and as that separates, these are all spurting out blood. So a gush of blood as that separates is what we expect, and find the 500. So about 500 mils is fine. And that wouldn't look too bad if I poured that out, added a bit of amniotic fluid, then it's starting to get a bit messy. But that's totally normal and what we expect. So that bleeding, as the uterus starts to clamp down and you push that placenta out, it will start to ease a bit. And your midwife is keeping an eye on this. It just feels a bit uncomfortable. If there's quite a bit of blood, she might ask you just to lift your bum up a little bit. She changes a absorbent mat under you. Don't worry about that, just focus on Bubba in your arms. And then it's going to be, for the first couple of days, like you're having a really heavy period. And we provide at the hospital what we affectionately call surfboards. Okay? It's about the size of a newborn nappy. So if you get caught out, use a newborn nappy. And these are what you're going to need for the first couple of days. And then you move down to like a standard maternity pad that you get from the supermarket. And then it's going to get less and less. Like when you have your period, it changes colour, and then you'll get the annoying spotting at the end and you think, yay, I'm done. And then it's like, oh no, a bit more. And it can go anywhere from 2 to 6 weeks. I thought that was a fair exchange. No periods for 9 months. Another goodness knows how long before I get them back again. So 6 weeks, when I'm in a blur state anyway, was fine by me. But you do need to go and get some big Nana undies, because it's going to be messy. You want them to come up high and a dark colour, because you have a bit of leakage in those early days, and you need the big undies to hold these in place. Okay. When you get up to have your shower, in the shower rooms at the hospital, we've got more pads, and then if you like, you can put on a pair of our super sexy contraceptive disposable undies. These are so comfy. They look hideous, but they are really comfy. And you're only allowed one pair because they're expensive, so bring some other big undies as well as wearing a pair of those when you first showered.
The bleeding after a baby can be a bit disconcerting when you're not used to it. So when you're sitting on the bed breastfeeding, the feeding makes your uterus contract and you can get what we call after pains. And so that's directly related to the breastfeeding, but we like that because it means that uterus is clamping down. But when it clamps down, you can also get these sort of gushes of blood. In that first sort of hour or two after the baby's born, it feels like quite warm, quite wet. You have these gushes and you're never kind of sure, is this okay or is this not? So your midwife will be constantly checking in, and if you said to her, oh, I think I'm having quite a gush of blood, she would actually want you to lift your leg up and be able to pull the pad back so that she can see the amount of blood on the pad, so that she can assess, is that normal and okay, or is that not okay and I need to do something else about it. If you did start to bleed heavily, one of the first things that a midwife does is to put her hand on your belly. We're finding the top of your uterus, which would be hopefully clamping down, and if it's not, she might rub at your tummy, and that makes your uterus contract, and that is uncomfortable. But she does that first, and then if that doesn't work, then there's other drugs and other things that she can start doing to control any bleeding. But she will be constantly checking in on that pad. The other things that we give you are these absorbent mats that Natasha was talking about, and you sit on those for like 2 to 3 days after the baby is born, because again, when you're sitting breastfeeding, you have this big gush, it flows out of your pad, through your undies, through whatever clothes you're wearing, and onto the mat. So just be aware that that is normal, but it is messy and it is annoying. So if you're going home early, they'll give you some of those mats, and just pop those on the couch or wherever you're sitting when you're breastfeeding, just to make sure you keep things under control at home.
And with your bleeding, when it eases off and you think it's stopped, if you go for a high cut parahaki or something crazy like that, you will probably cause a fresh bleed because you've got all the blood circulating nicely again. So if it's been a couple of weeks and then you get a fresh bleed, just be very careful, because that's probably your period back, which means you've ovulated, you're fertile again. So just be very careful of that. If at any time your blood loss starts to smell offensive, tell your midwife, because that's a sign of infection. And also, if you do get your period back within the first few months, still use pads, because those pelvic floor muscles need to tighten back up to hold in. If you're wanting to use tampons or a moon cup, then everything needs to be tight again to hold that. And also there's a risk of infection. So stick with pads if it comes back in those first few months. But do your pelvic floor exercises, tone everything back up.
Another thing that can happen with bleeding is that you can actually pass clots after a baby. So initially the bleeding is quite fresh and just comes away normally looking like blood, but then you can get this congealed blood. So that's a clot. It looks a bit like jelly. It all sits together usually in a bit of a clump, and a clot can be anything from the size of a $2 coin up to the size of a grapefruit. Okay, so if it's getting up to the size of a grapefruit, that's not so normal. You definitely want to be mentioning that to a midwife if you're passing those, but really normal for the $2 or like ping pong sized clots to be coming away. What is tricky with clots is that you often pass them when you're sitting on the toilet doing wheeze anyway. So you're going to the toilet and then you hear all this sploshing into the toilet, and you look in the toilet afterwards and think, oh my goodness. If in the hospital, often women ring the buzzer and get a midwife or a nurse to come in and have a look down the toilet to see what happened. We don't need to see what's down the toilet, but you definitely need to mention to a midwife if you are passing, so your own midwife, passing lots of clots, because we might need to check that out. I was looking after a lady one day, and she had been sitting breastfeeding. When she hopped up off the bed to go to the toilet, a clot just fell out of her vagina, past her undies, and just slopped on the floor. And I heard it hit the floor, and I heard her go, oh, and I went in, I popped some gloves on and picked the clot up and took it away into another room and had a look through it. And it was quite a big clot, and it had little bits of the placenta and the membranes in the clot. So her body had done exactly the right thing. So that was still left inside her uterus. It had bled around it and flushed it out. And as soon as she passed that clot, her bleeding slowed down and she felt heaps better. So, but just checking with your midwife and letting her know if you're passing lots of clots.
Often people wonder when they can start having sex again and seem to have a 6-week mark labelled. I don't know why, but basically it's up to you and how you're feeling, how your birth went, how your baby is. If you've got a really unsettled baby, or you had stitches or a C-section, you might not be interested at all. So it's when you feel ready, but it's going to feel different. Some people say it's better, some people say it's the same, but in those early months, or when you're breastfeeding, the hormones that are going around mean that you don't lubricate down there. as you should. So get some KY gel or even some coconut oil, and that will help make it more comfortable for you. And it's going to be a bit hit and miss first time, so just give it a go. If it's not working, just like, whoa, no, we'll try again another day. But just, yeah, take it easy, take your time. And yeah, if you're not feeling like it, then just let your partner know that you do still love them and care about them. It's just you're not in the mood right now. And it is, that communication is so important with your partner, to know that you both love and appreciate each other, even though this little person has completely taken over your life. Yeah, it's so important. And letting your partner or other family members have bonding time with the baby to give you a break and for them, because they're not getting to be with baby the whole time like you are. So it's really nice to kind of, love you, you're a great parent, there you go, take the kid, I'm going to have a break. So it's so important. And something we've heard from a physio that comes and does talks sometimes about pelvic floor muscles is, our takeaway thing from her talk is, if you've got good pelvic floor muscles, you'll have better orgasms. So there you go, ladies. Do your pelvic floor squeezes.
So the return to sex thing, I think if your partner's not sitting with you, if you have a partner in your life and they're not sitting with you at the moment, this is something that you really talk about before you have a baby, making sure that they know that you'll give them the thumbs up when you're feeling like it again, and that it is going to be just trial and error, so that you try, and that if you say, no, this isn't working for me, that they know to stop. So it needs to be comfortable for both of you, and that absolutely what Natasha was saying, still making sure that you know that you love each other. So you may not be having sex, but still love and appreciate each other in whatever way works for your relationship. Other changes that can happen after a baby is that your vagina can feel quite different. So in the early days after a baby, it can feel quite swollen and quite sore, and you think, my goodness, is this ever going to feel normal again? But that part of your body has got amazing blood supply and it heals really quickly. So quite quickly you'll notice that it's healing, the swelling goes down and it feels more comfortable. What things that can take a bit longer is stitches. If they've had to do any repair down there, that can take a while before that feels normal again. But that everything can feel a bit stretched up and a bit different down there. Okay, so, and it can take quite a while for that to feel like it did before you had a baby. Some people actually notice improvement around like their vagina and how it feels and like having sex again. Other people it doesn't feel so right. So talk to your GP, talk to your midwife while she's still looking after you, and make sure if you need any kind of referrals that they can follow that up for you. The last couple of things that we talk about are things that I kind of struggled with or learnt through having my first baby. And I was really surprised but also pleased that somebody told me that I may not feel instant love for my first baby when I had him. And I remember at the time thinking, I don't think that'll be me. I think I'll feel this instant love and attachment and bond to the baby. But I kind of still took it on board what they said, that it might take me a little while. And as a midwife, I'd been a midwife before I'd had my own children, and you really see the differences for women. Some women, as soon as they pop a baby out, they have got their hands on that baby, they've got them up in their arms, and they're holding on to them, kissing them, just instantly in love with the baby. And just they won't let go of the baby. They're like they're theirs and they're just back off. And other women, that when they push the baby out, there's such relief of having had a baby and that you've done this massive job of getting them out, that you just need a minute to have a breather and to realise that you've done it, and that it's okay for somebody else to have the baby for a little bit rather than directly into your arms. And so that was absolutely me with my first baby. I had had this amazing home birth. There was nothing traumatic or full on about it. But when I did finally push out my first son, I remember I didn't know what I was having. And so I said to the midwife, what is it? And she said, it's a boy. And I was like, yay, that's cool. And then I said, is he okay? And she said, yep, he's completely fine. And I was like, cool, give him to Alan. So give him to Alan, my husband. I just didn't want to hold him in that moment initially. I just wanted to sit back and think, yay, I have done this. And I got the placenta out and did all that other kind of stuff. So it was about sort of 20 minutes before I said, right, where is this baby? And had him give him back to me, and then he was mine. And we instantly connected and instantly were in love. But the cool thing about that is that Alan, my husband, had the whole skin to skin and that initial bonding. So our first son is called Solomon. So Alan had that with him initially. He was pretty stoked about having that, and then he was very happy to give him to me when I wanted him. So you may go either way, instant love and attachment, or it might just take you a few minutes to get into the baby bit of things. So the other thing that I really struggled with after I had my first son was hormones, and so the highs and lows of hormones. We totally know that when women have a baby, that is usually as soon as they're out, women are on a real high. So even though they've really struggled through this labour, it's been long and tiring usually and hard work, you have a baby and instantly you're on this high of, oh my gosh, I've done this, this amazing little person that I've created, and you're on this high of texting 50 million people telling them that the baby's here, and people say, right now lie down and try and have a sleep, and you can't because you're just looking at this amazing thing that you've created. Usually that first day you're on that high, and every breastfeed is exciting and it's quite cool, it's all new and exciting. Usually the second day, so you start to come down off that high. The baby is feeding a bit more, your nipples are starting to get sore, you're starting to feel the effects of the tiredness, and you start to sort of come down off that high. By the third day, you crash and burn. And so you might not have cried on the second day, but on the third day you are in floods of tears. And sometimes you can even feel happy, but you're crying. Okay, so if you've had just these uncontrollable tears, I really recommend that you cry. Cry it out. The more you try and hold in the tears, the worse it gets. So cry, let all that emotion go, give the baby to somebody else, go and have a shower, eat some chocolate, get a nice big hug from your family and from those people around you. And usually that third day is hard because your milk comes in as well. So this baby's been feeding and feeding to try and get your milk to come in. And on the third day, you wake up with humongous, sore, engorged boobs. It is really tricky to get the baby on that third day. Everything's starting to feel a bit hard. You start thinking about putting the baby back because you're not into it anymore. That's what I felt like. And then from there, your days start to get a bit up and down. Okay, so some days you'll feel really happy, like you've got it, you're loving the baby, everything's going well. And then the next day you'll have a bit of a downer where you're crying, you're not sure what you're doing anymore. So the highs and lows after a baby, really normal. And that can happen for quite a few weeks while you're adjusting to this new little life in your family. What isn't normal is if you have constant lows, if you're not having those highs as well, and if that low just continues on where you're not sleeping so well, you're not eating, you're feeling anxious, you're not feeling that connection with the baby, you're struggling with people around you, and everything's just starting to feel a bit hard and a bit dark, that might be becoming postnatal depression. We know that postnatal depression can happen any time in that first year after a baby is born. So you might find this first 6 months okay, but the second 6 months you start to dip down and feel quite low. If you are struggling, if you're feeling yuck like this, you need to speak to your midwife if she's still looking after you, or go and see your GP. There are amazing services like our building that you can ring. You can come and see Natasha or I. You can talk to us. We can do referrals for you through to an amazing service that we have here in Whangarei Hospital, which is the maternal mental health team. They have got counsellors, they've got psychologists, they've got psychiatrists. We can absolutely help you if you are feeling not so good or not enjoying it the way that you want to.
And it's not just you mums that might struggle with postnatal depression. For us, it's more a hormone thing, but dads can get it too. And for them, it's more the change in roles and responsibilities and having to share you and just this new little person that suddenly is here, and it's real. And it's a big adjustment. So that's why it's so important to take care of each other. Make sure you are talking, make sure you've got other people you can talk to. And if you don't want to talk to someone face to face, there's phone numbers, there's websites, there's all sorts of options. But definitely get help if you're not feeling great, because it's a horrible headspace to be in, and the sooner you get on top of it, the easier it is to deal with. Whereas if you leave it going on and on, it's a lot harder to deal with. So definitely take care of each other and take care of yourself.